Welcome back to Module 4, Part 4. I think I'm getting a little confused. I think it's Module 4, Part 4. We're getting a little bit, no, I believe this is Part 5. We're getting a little bit ahead of ourselves. Just taking a little bit longer, so I do apologize. But I just wanted to show you what a normal head CT looks like. So when you're able to go down for a CAT scan for your patients of the brain, I would like for you to look at, they're all labeled over here, but I'm going to show you what I personally see. I see a little old man, little Chinese man. Here's his eyes here. Here's his nose. And then there's his mouth. So if you guys ever look, you're looking for, and then here's like two little buds on the side, or you can say two little teeth hanging out. So when you look, kind of look in a circle. And you can see the little old man. That's what we do at nurses when we're looking for a normal CT versus abnormal CT. Okay? Ask yourself, what do you see with this assessment? What would you ask your patient to do? Remember how you asked them to puff their cheeks out? Look at this one. This is a commonly used. You see the right side facial droop? All of that. You see the hand? She's able to hold one up and unable to hold the other. This is just another helpful slide. Just so you guys know what's going on in what part of the brain. This is, I thought, was a very helpful slide. Don't forget, stroke isn't a medical emergency. Please don't forget your ABCs. Make sure you get your patient's history and physical. Make sure you know when the symptoms started, their medical history, medications, are they on any blood thinners, and don't forget your famous National Institute of Health stroke scale. Here is some lab work that needs to be done that we didn't speak of earlier. So these are very important, especially your INR. We want to know what the INR is. That's the patient's bleeding time, okay? And the other labs that we're speaking of. Imaging testings, you do have the CT, indicate if ischemic or hemorrhagic stroke. After the first 24 hours, the CT shows progressive changes of ischemia, infarction, and cerebral edema. Sometimes after the CT, the physicians order an MRI. And here's your MRI. It'll show the edema, ischemia, and tissue necrosis, and more. Acute treatment for ischemic treatment is implemented within 3 hours of onset of stroke. We do have to, very importantly, informed consent obtained after risk and benefits are explained. So there's a list that we provide to the patient for the risk and benefits, and then we get an informed consent. So here's TPA, what I spoke of. I wasn't sure if the recording was going. I'm going to go a little backwards just in case if I missed anything. So I was talking, I wasn't sure if I was recording acute treatment for ischemic. We'll go over the video in the class. Acute treatment for ischemic with the fibrinolytics. And then also, I was speaking earlier about the TPA within that 3-hour window, but according to the Stroke Association, it's 3 to 4.5 hour window. The time the symptoms occur to the time the patient gets the medication. Here's other acute treatments for ischemic, and it's here, and we can talk about those, and they were also in the videos. Intracranial pressures. Don't pay attention to the page numbers here. I didn't have time to delete those. And then this is how to control intracranial pressures. But we're not going to be deep off into this. So I don't want, this is information only. Right now, the how to control intracranial pressures, information only, as well as this continuation of the slide. Okay. We do have acute treatment for hemorrhagic. We showed you a video on that, and basically a surgical intervention. So ongoing treatment would be, of course, physical therapy, occupational therapy, speech, which deals with the swallowing, all of those things to help the patient get back to at least to their normal function or their par function before the incident happened. So here's ongoing, I'm not sure if I accidentally hit that, ongoing drug therapy, so they will be on anticoagulations to prevent further thrombolytic episodes like Coumadin, and especially if they have a condition in their rhythm called atrial fibrillation. And also they'll probably be on aspirin too. Those drugs are controlled by either the physician or the pharmacist by lab values, getting their INR, PT, PTT drawn. So here's more information. You want the patients on stool softeners, analgesics. We'll review videos in class. And here's our famous nursing diagnosis. So see if you can see about some of these or come up with some of these nursing diagnoses when you treat your patients. Any questions, I'll be happy to answer in class, and we will review some of the videos also, but you're unable to copy and paste from here because it's a video, but if you write them down, if you wanted to watch these videos sooner, you can see it. And also the PowerPoint has been posted, so you can also see these videos and copy and paste them into the link, and you'll be able to see the videos. Thank you, and thank you for your time and patience for this extended lecture.